Hi, MCs. Yana here, and I have a special gift for you. I've had so many of you reach out regarding podcasting and how to know if podcasting is for you. Well, I've created a free guide just for you with what I consider the fundamental 5 questions you should consider before starting your show. All you have to do is visit freepodcastguide.com to get your copy on the house. I hope this makes your 2020 just a little bit brighter. Just go to freepodcastguide.com. That's freepodcastguide.com. Now melanate on that. This week on Melanated Conversations, we gather around the table for another group chat with our friend and former guest of the show, Jasmine Berry. Jazz is a board-certified family nurse practitioner with a background and focus on infectious disease. On this episode, we chat with Jazz on the real regarding life behind the scenes as a provider on the front lines battling this pandemic. Jazz gets candid about her own mental and physical well-being during this crisis, and collectively, we share our thoughts on doing our part together to curb this pandemic. We laugh, we learn, we get real, y'all, in this group chat. So pull up a chair and kick it with us.
Welcome to Melanated Conversations, our narrative from our perspective.
Here on the podcast, we are amplifying the voices of Black women and sharing their powerful stories of transformation.
I'm Tyrion.
And I'm Yana. Let's start the show.
Welcome back, ladies and gentlemen, to another episode of Melanated Conversations. I'm your co-host, Tyrion.
And I'm your co-host, Yana.
We are so excited to have this conversation today. This is actually going to be part of our group chat series where we get a little bit more in depth about certain topics, talk about, some serious stuff. And so today we actually have a former guest on the show, former guest and friend and super supporter.
Yeah.
She's
since day one.
Day one.
She was actually in season 1.
She was in season 1.
It's y'all on season 3 now, honey.
We are. So welcome back to the show, Miss Jasmine Berry.
Jasmine Berry.
Jasmine Berry. Jasmine Berry.
I wonder how many times you hear that, and that probably gets on your nerves.
No.
Really?
No.
That's
it hypes me up. No, it just hypes me up.
Because I feel like that's the first time I've ever said that to you.
I love it.
All right, well, we gonna keep it.
If I was part of an organization and it was a non-hazing organization, that could have been, something that I would have had, my girls greet me with or something like that.
Got it. Okay.
Yeah.
All right. You foolish. You are so foolish. Well, as you know, like I said, we had Jasmine back in season 1 as a featured guest. And Jasmine is a family nurse practitioner. And what are you studying right now?
My doctorate in nursing practice.
Okay, now.
Yeah.
So,
Dr. Berry.
So I am staying clinical. I'm not getting the research doctorate. I'm staying clinical. So that's where the DNP, Doctorate of Nursing Practice.
Nice. Sis out here doing big things. So she's going to, she's going to school us. She's going to educate us today on some real serious stuff. But before we do that.
Yeah, before we get into the real serious, because we have some things that we want to address and talk about. But before we go into that, we just kind of want to loosen up a little bit. We have one, we're going to throw out a rapid fire before we get started. So I just want to ask, this is just jump straight into it. Because you already know how this works, Jasmine. We don't have to explain. But
No.
There hasn't been much room for us to do, various things, with, the current state of affairs with our with COVID, with everything that's going on. has there been anything? Has there been a spontaneous moment that you've been able to have?
Y'all Golden Girls fans?
Yes.
Picture it. Fayetteville, Georgia, yesterday. I was sitting in the office because I had a light clinic schedule. I was like, I wonder what it looked like if I had a nose ring. So I found a filter on Instagram. It's like a piercing filter. So you can put piercings wherever on your face to see how it looks. I polled people on Instagram. And before I even got done with the poll, I was like, I'm finna just go get it. So I made me an appointment. I got my nose pierced yesterday.
Twig.
Yeah, there.
Look at y'all.
Okay. Yes, Lord. Yes, ma'am.
Yeah.
Things we love to see.
Yes, Black-owned business, Black piercer. Thank you.
Nice.
I need her deets. Is
Yeah.
this in Atlanta?
Mm-hmm. Yeah. Iron Palm Tattoos is downtown off of Trinity Avenue.
Yeah, send the info.
Does it
Mhm.
hurt?
I mean, it.
No, because I'm saying it's fresh. You said yesterday, right?
Yeah, like less than 24 hours ago. I got done like 5 o'clock yesterday.
It shouldn't. If it's done right.
Yeah,
it
I mean,
shouldn't hurt.
It was a quick, I won't say pinch, but like a quick like plunge. Made my eye water a little bit, and then it was like, oh, that's it.
She's the needle.
Mm-hmm.
Yeah.
Yeah.
So,
I mean, it's in there.
Ciao. Nose twinklings and everything.
Yeah. Look, we trying to be twinks for real, okay?
Right.
Trying to be twinks for real.
I love it. I told Terry and I wanted one. Like, was it early this year? I can't remember.
I feel like you said something about it.
Because I was like, you got to take me to the person.
Do it.
But yeah, I like it.
Literally, you can't overthink anything. Just go and do it.
Yeah.
That's real.
Okay, well, you want to go?
Mine is not like super spontaneous. I had a moment like what Jasmine had years ago where we was out in Conway. It was, I think, it may have been like a Saturday or something like that. And me and some friends was like in the dorm was like, let's go get our tongues pierced. That's just what we did. So I had a piercing moment like that. But that was,
I remember that.
Like 17, 16 years ago.
YOLO.
But like in quarantine, man, this is not like a fun, like, ooh, that's super spontaneous moment. Like, I love to go skating. Clearly, those type of establishments, to my knowledge, aren't open. They may be in some place. Well,
come to Georgia. Come to Georgia.
Well, I said where we are. They might be open too. But I feel like at the time it was when everybody was like, they had just finally decided to lock things down. But I do have a pair of rollerblades because I'm a rollerblader. And I was like, let me hit these hills around the neighborhood. And so, I threw on my long socks and
that's cute.
Shorts and put my hair in some pigtails, and I hit up the neighborhood in my rollerblades. And it was fun. And I hadn't done it in a while. And I actually never skated in my neighborhood currently, and I didn't realize like it's a lot of hills through here.
I was just thinking that. I was like, you got a hilly neighborhood.
It's a super hilly neighborhood, and it's crazy because growing up, the rollerblades I had the brakes on the front and the back. Well, the adult rollerblades, they only put the brake on one skate on the back. So I was like, they didn't put the
on one skate, not both.
Not both. So sis was struggling.
Like on your dominant foot, or what they think your dominant foot would be?
On what they would think my dominant foot would be.
But everyone's not.
Right.
I ain't gonna get into it. All right.
Yeah. Okay. So that was a fun, spontaneous moment. And to a point where I was like, oh, I should do this more often. And I literally have only done it once since we've been supposed to be staying in the house.
But that's why it remains spontaneous.
Exactly. Mm-hmm.
So. Well, for me, this past weekend, my brother, he lives like maybe 5 minutes away, called and was like, can the girls come over? We hadn't turned down, a time for ourselves in a minute. So,
right.
So they ended up staying over my brother's, with my nephew and everything over the weekend. And we were like, we're kid free. What do we do? So we were actually just going out to just grab some takeout. But then we were like, how about, because normally we would just ride around because you can't go nowhere. So what we typically do is just ride throughout Dallas, ride around, just see the scene a little bit. But we were like, how about we turn on the Uber app, do Uber delivery only, and pay for our date and just ride through the city. So that's what we did. We had a Uber date night. So we just rode throughout the city. Thankfully everything is, how they have it set up. There's really no contact. So we didn't have to contact with any of the people, just drop it on their doorstep. Most people bring the delivery stuff to you, or they have a certain designated spot. So you don't have, there's no direct contact with really anybody. So, husband driving, we're just riding. He make his stop, pick up, we'll drop it off. And then on our way, we stopped at our downtown. We stopped at our favorite Black woman owned chocolatier and got some treats. But yeah, that was kind of spontaneous for us because we didn't know we were going to have time to ourselves and
a whole weekend.
Man, it was actually fun, and we made money. So we made money on a date night. It paid for our entire date night, and we had money to set aside for another date night, which is cool.
I'm not mad about it. I'm not mad about it.
So Uber date night, try it with your mate.
I like spontaneous things where you make money now.
That's right. Nice. That's dope. That is dope and very unique.
And we were masked up. And and everything.
Of course. So. Of course. We're gonna talk more about that.
Yeah.
Masked up.
Masked up.
But also too, we have, as we mentioned, we have our good friend Jasmine on, and when we get together, it's just kind of like we forget that, we talking to y'all. It's just
a reunion.
Yeah.
For real.
So okay, so going into kind of the chat today. So Jasmine, we brought you on because right now, and what it seems like will not be, what seems to be our kind of new normal for a while now, because people don't seem to want to act right.
Don't want to sit down.
Right.
We wanted to just have this conversation with you as someone who's actually on the front lines as a first responder, really battling this on the other side. We wanted to have, just bring you on to tell us a little bit about your experience and kind of how you feel about everything that's going on. So can you begin with telling us a little bit what it's been like for you on the front lines and what like a typical day looks like for you?
Okay, so I will start out by letting everyone know, like Taryn said, I'm a nurse practitioner, family nurse practitioner, but I've been specializing in infectious diseases for past 3 years. So infectious diseases, for people who are unaware, HIV, AIDS, bloodstream infections, pneumonias, viruses, coronavirus. So I typically split my day between clinic, where I see outpatients, hospital follow-ups, new patients for skin infections, bone infections, IV antibiotics, whatever. And then the other half of the day, I do hospital rounds in the clinic, and we typically get consulted to help with antibiotics, to help with infectious workup specifically. And since I guess my hospital had patient 0, I believe back in March. So we've been helping out then, just with, initially it was like with the testing of coronavirus and, whether this patient fit the criteria to be tested, because, at one point in time we only had X amount of tests. But now it's to help with antivirals, antibiotics, if patients are febrile for far longer than they expect them to. So they'll get us consults to help with infectious workups. Wow. And then there was a second part of that question.
Yeah, you kind of you touched on it, kind of what a typical day looks like for you. The other part was kind of what has it been like for you on the front lines?
It's been interesting, to say the least. Like, it's been a whole range of emotions, an emotional roller coaster, to be completely honest. Because I was on call the weekend we had patient zero meaning our first coronavirus case in our clinic or in our hospital. So, it was a huge thing like, oh, we're going to see a patient, And my physician, she actually wasn't at the hospital and she was like, are you comfortable seeing the patient? I'm like, it's a person, it's not like he's got Ebola. It is what it is. So, it went from it's not really a big deal to, now seeing the hospital completely different, like our ICUs and our IMCU, our step down unit got completely turned around just because those are the only patients that were being hospitalized at the point in time. So went from, not a big deal to kind of annoyance of everyone talking about it. And that was the only thing that people could talk about was coronavirus, what is coronavirus, this, that, and the other. Then to sadness and wanting to help because I'm a nurse practitioner, so I am not taking care of patients for a full 12 hours like I used to. I'm not at the bedside. I may see a patient for 10, 15 minutes, max, maybe 30 minutes, and then I go on to the next room. So, that wanting to be a bedside nurse, that feeling never leaves you where you just want to be able to help your others, like you want to be able to help, your team. So went from sadness, then frustration to, we don't have enough PPE. Our government, specifically, I'm here in Georgia. So our governor, I didn't vote for him, but Governor Kemp is showing why Stacey Abrams should have been governor. But that's a whole nother conversation. Him and the current president stating, we don't need masks. We don't need this, whatever. We can continue business as usual. To, maybe there's hope, the numbers are going down and now people are back up and now we're having another surge and, not being hopeful. So it's truly been a range of emotions.
Yeah, I was going to ask, that was going to be my next question. What's been the most frustrating issue during this pandemic? And I just want to say too, because I think sometimes people forget, even from a healthcare perspective, like this is new. Like this is a new virus. Like it's not something that's been studied or been watched in a lab per se.
Well, this is a new strain of the coronavirus.
Right.
Yeah, new strain.
Right.
Yeah.
Sorry. Yeah. New strain. And so there are so many unknowns with this. People's bodies are responding and reacting differently. We don't know what long-term effects this may have on individuals who've been exposed and contracted the virus. So there's so many other things that are attached to this. But
yeah,
as you kind of stated, I think from the standpoint of like not having enough PPE, right. And then just the politics, how this became a political issue. I
think that's the biggest stressor is like, this is not a political issue. This is truly a healthcare issue and the health of the American citizens. And honestly, not just the American citizens, but, all over the world, but clearly the world has it under control for the most part. And
yeah, let's talk about this correlation, especially because, you're in the Atlanta area and there's this big correlation between Black folks and coronavirus. And as well, thinking holistically of all the communities that are predominantly or have higher populations of Black and Brown individuals, they also tend to be the areas that have more lack of resources available in their communities. Can you share just from the medical side, what have you guys seen too from that standpoint?
So I can share what I have seen specifically, like myself and the patients that I've seen. I've honestly seen an array of patients. I've seen Black, brown, white, old, young, immunocompromised, those, without a lot of medical issues. But I guess the ones that I've seen that do maybe the worst or like would crump the quickest, there's this one patient that stands out in my mind. I saw her on a Friday. I did a consult with her on a Friday and she was on a regular medical floor and just doing the consult, like meaning a consult is the first time that I'm seeing her. The medicine team, the hospitalist wanted us to come and help with antibiotics, figuring out what the appropriate treatment would be. And when I tell you she was so short of breath, like she was already on 6 liters of oxygen, which is a lot of oxygen from a with the traditional nasal cannula. And she was talking like this. And she said that she had stayed at home for probably about a week. And she said that her daughter had encouraged her to go to the doctor. But she was like, one of the last things she said to me was like, I should have listened to my daughter. And, I didn't push her to talk a whole bunch because I knew she was having trouble, forming words because she was that short of breath. And I remember telling my physician over the weekend, like, just watch out for her. I feel like she's gonna, she's probably gonna crump quickly, just how short of breath she was. So from Friday when I left, she ended up coding, meaning that her heart stopped on that Friday afternoon. She was in the ICU and she was on what we call full pressure support. So using medications to help keep her blood pressure stable, keep her heart going. Essentially, she was on a ventilator, and by Monday morning, she was dead. So 53 years old, I think, Black woman. So I think the correlation that we are seeing, and of course, like Taryn, like you mentioned before, we won't see a lot of strong evidence, until like a year, 18 months later, when we can, get really solid numbers and continue and, see patterns. Yeah. But I think one of the biggest things is probably fear of the medical community and a lack of trust. I know a lot of individuals, especially like probably our parents and maybe if our grandparents are still living, the Tuskegee experiment is one of those things that comes is in the forefront of everyone's mind. What I will remind everybody is that like research has gone a long way from then. And, one of the biggest things with the Tuskegee experiment was that there's not informed consent. So I hear people talking about the vaccine trials and they don't want to be guinea pigs. What I want to stress to all of us that are Black and brown is that we are disproportionately affected. So we have to be in trials to know if the vaccine is going to be helpful. Because if you get nothing but white men and white women in these trials, we don't know how it's going to affect us. So informed consent is a thing, and informed consent has to happen if the trial is actually going to happen. But so that's my little caveat. And the other thing I think is lack of good knowledge. I know, I don't want to say a lot of us, but when we hear, our grandmothers or generations beyond saying, just stay at home, use a at-home remedy to get rid of a cold, use this, use that. This is not a common cold. So some of that knowledge, some of that you have to get rid of that in this situation. If you're sitting at home short of breath and you're having chest pain, you all of a sudden can't smell, you can't taste. Like sometimes you just can't sit at home. You can't rub garlic on your chest and make that feel better. I'm not saying that a mixture of Eastern medicine and Western medicine don't help. But in this situation, if you're sitting at home and you literally can't breathe, you can't just get home. If we continue to sit at home and do these things for far too long, then yes, we could have detrimental effects and we could see, a higher number of deaths in Black and brown individuals.
Yeah, I kind of two-parter. I had an uncle who passed away back in I think it was March. Early March. To this day, still don't know if it was coronavirus. I highly suspect that it was because the family, his wife never really gave us information. But from what I do know is that he was having what seemed to be a flu that would not go away. Went to the doctor. I think the doctor was just kind of like, it's just kind of viral, flu, whatever, kind of just go home, take it easy. Started to get progressively worse. And then he was like, well, I guess since this is just what it should go away type of thing, I'm just going to wait it out at home. And then by the time it had gotten so severe or too severe, it was too late. It was too late, and ultimately succumbed to pneumonia, and so didn't have any, from my understanding, underlying health conditions or anything like that. Had not, pretty healthy, and so it was definitely kind of like a shock. And like I said, and coronavirus was just starting to like hit our shores and start to being talked about. So he was probably one of those, and he was in the Atlanta area. Just one of those one of those things where, it was still new and fresh. So we weren't sure, we don't even know if he had even been tested for it, but definitely believe that probably was what, caused, was part of the cause of death. Can you explain to those listeners who just may not, we hear the talk of coronavirus and all the different things, but you stated earlier, like, this is not just a common cold. Can you kind of just briefly explain to us what coronavirus is and kind of the implications that it could potentially have on us?
So coronavirus, it's a novel new strain of the coronavirus. Like if you were to go look on the Lysol cans, you'll see coronavirus. So coronavirus typically will cause flu or cold-like symptoms. So what this strain, COVID-19, it's just like the flu attacks the lungs specifically. But with the coronavirus, I think it's attacking the lungs much stronger, and there's a huge inflammatory component with it. So that's why you get a lot of the chest pain. That's why you get that dry cough where you feel like there's something there, but you can't cough anything up. So it's not productive, meaning it's not a whole bunch of mucus. It's not like a common cold, but it's just a dry, hacking cough. Like I said, it's a lot of inflammation that goes along with it. I'm not 100% sure where the lack of taste, where all of a sudden you just have a loss of taste and a loss of smell. There's nausea and vomiting that goes along with it, and diarrhea as well too. So like the pathophysiology, I am not 100%, I'm not, what's the word? I'm not 100% well versed on the patho, other than I know there's a huge, what we call cytokine storm, where it's just inflammation in the lungs. And this is why the lungs take such an insult. This is why the shortness of breath, and why it takes so long to recover from the coronavirus as well too, because it's that inflammatory component that, trying to use antivirals to help, trying to use other modalities such as, walking around using, we call incentive spirometers to help reinflate those lungs. But I think this is one of the reasons why they're seeing patients vented on the ventilators for so long, because it just takes a lot of time to heal those lungs as well too. And the other thing that we're seeing from the coronavirus, and I think it's with that inflammatory component, which probably inflammation and what am I trying to say? The clotting factors, but we're seeing a lot of blood clots that come from coronavirus as well too. It's kind of what we call the inflammatory cascade.
Yeah, I saw a guy I knew growing up, and he had posted on Facebook about back in June that he had gotten coronavirus back in March, and then early June suffered from a blood clot. And I was like, that was crazy to me, just to be like, so you catch this virus, and then there are these after effects from it on top of that. That's crazy.
Yeah, it's just we're now, so patients that we've seen where I currently work, some of the worst off cases that people who actually survived were in the hospital for 2 months. And I know that recently, probably within the past week and a half to 2, we've had a couple of readmissions of patients who had, survived the first bout of coronavirus and now are coming back. And with pneumonias for the biggest thing. So it would be interesting to see from a medical perspective the long-term effects of the coronavirus, and what happens in terms of survival, the actual survival rates, maybe a year post-COVID, survival rates, will they be high? If you do survive the initial bout of COVID, will you succumb to something else?
What are the protocols for you guys to ensure your safety and keeping you guys protected as you are assisting patients?
Well, and I'm sure this is in most healthcare organizations now, but if you are what we call a current stakeholder, basically if you have any type of position within the healthcare system, you have to wear a mask while on campus. The masks are required. I hear coming down the pipeline, everyone is going to have to wear a face shield or goggles to protect your eyes, because the mask, protects our nose and our mouth, but it doesn't protect your eyes because droplets can get into that orifice as well. But if we have a patient that we suspect that we're going to test for coronavirus, even if we have like a lower suspicion, but we still want to test them for coronavirus, they get placed on modified enhanced respiratory contact, something like that. So basically it means that going into the room, you have to wear gloves, gown, a mask, and typically, so there's been talks of going back and forth of whether you wear N95, and the N95 is that particulate, that clam shell mask that you can't really breathe well in, but you wear it anyway. You don't want to get coronavirus. You wear that in the room, and then you wear a face shield or you wear goggles. And some people will wear like booties on their shoes, and some people wear like bouffant caps to hair, because there's been some studies about, whether coronavirus lays on the surface. But, typically we, depending upon what we're seeing the patient for, sometimes if you don't necessarily have to touch the patient, stay six feet away and try to maintain your distance while still wearing your PPE, your personal protective equipment.
Is there like I'm sorry if I'm getting really deep with this, but is there some type of protocol too from like after you've seen a corona patient that you can't see like regular non-affected patients?
I wish y'all could see my face right now. No.
Oh, I can see your face.
No. So the coronavirus patients or suspected coronavirus patients are what we call cohorted on specific floors, if possible, meaning that, we have floors that are specifically for coronavirus patients, so that you're not having what we call like mixing of other patients. That I think it's low risk, of course. So, if a patient is sitting in the room, because if you have coronavirus and you are, or suspect to have coronavirus, you are isolated to your room. You cannot come out of the room. You can't have visitors. We're currently on a no visitor policy anyway, unless it's special situations like end of life. But no. So what a lot of us will do provider wise is that we will kind of triage or do acuity wise. We will try and see maybe like in the morning, see all of our coronavirus patients or suspected coronavirus patients, degown, do all the other type of stuff, and then wear the proper PPE, just a mask, and the patients who are not affected with coronavirus, and try and group those together. And I mean, that's kind of provider specific. But the thought is if you are doing proper hand hygiene, when you're there's a specific way to take off your PPE before you walk out of the room, and, wash your hands, and, sanitizing after you come out of the room, and cleaning your PPE. You should not be transmitting the virus if you are affected with it. And this is the same thing of being out, out in public. This is why it's important to wear masks, why it's important to do hand hygiene, why it's important to socially distance and to stay at least 6 feet away from others, and to, people less than 10 people or 10 people or less in, in group settings.
Yeah, that's important. The media definitely takes over a lot of the narrative surrounding this issue. That's where we're getting a lot of our information, the majority of our information. Mm-hmm. But from your firsthand experiences, are you seeing things that are not being addressed in the media, or is there information that just is not true that the media is, the information that they're giving out to the public?
So I can half answer that question because I don't watch I don't watch the news because the news only, gives you negative perspectives on things.
Yeah.
But what I, just walking into patient rooms, or when I see the news on, whether it be, I am in a part of Georgia where, we have individuals who like Fox News, whether it's Fox News, CNN, MSNBC, or just the regular, local news, is that, and we talked about this earlier, seems to be more of a political issue more than anything else. And, for those listeners who don't know, I'm in Georgia. Like I said, Governor Kemp, who is clearly Trump's crony, wants to sue the mayor of Atlanta for mandating that people wear masks. It's that, I guess that would be my biggest gripe, is that it seems to be more of a political issue than we really care about humanity, and we care about, the health of the American citizens. And, and I hate that this is happening during election year, because I think that maybe if this wasn't happening during election year, that it wouldn't be focused so much on politics. And but I think that's the biggest thing that the media gets wrong, or they put too much focus on. And then I think from a healthcare perspective, someone who, quote unquote, lines like the whole thank you and you guys are great and thanks for all that you do. Like it's actually crap if you're going to continue to do the same things that healthcare providers are actually telling you not to do. So, these media slots, these 30 seconds of, the sad music and, the nurses with the lines from the N95 and the clapping and the thank you. It's like,
I never even thought about it from that perspective.
I mean, like, if y'all are going to call us heroes and all this other stuff and, we'll give you free stuff, but we're at surge number 2. Clearly, y'all ain't hear nothing that we got to say.
You know what that correlates to me, Terry, and we just talked about this, is, kind of like with the whole Black Lives Matter movement, with everybody throwing up their black squares, and then it's going back. Same thing with, I didn't think about it from the same standpoint of healthcare. Like, we stand behind you.
Thank you so much. You've done so much. We appreciate it.
We see you.
We hear you. Do you? Are you listening to these politicians? There was something I saw on Facebook yesterday, and I wrote it down. And it was just talking about, the whole returning back to school. And someone put a sign up, was like, why should we go to school if the educated? Like, people who are educated medically, like you guys. Dr. Fauci, y'all put some respect on Dr. Fauci's name.
Man,
he tired of all of us, okay? This man, if, and I pray that coronavirus and nothing infectious takes him out, but like the stress of all this stuff is going to end up, what I'm saying, being his detriment, because it's like he didn't, it's like when you don't sign up to be, like he's not trying to run for any political office at all. Like he's really just, you ask this, just trying to keep folks alive.
That's it.
Like he's a physician. Like that's what he signed up to do. That was what the Lord placed him on this earth to do.
Right.
And y'all people are trying to make him seem like, oh, well, the CDC doesn't know what they're doing. There's new information coming out every single day. Like if you go back, how old are 30 plus years? When HIV AIDS was just finding out about it, there was like one medication to take. One medication, because you didn't know anything about it. We thought it was a gay man's disease. Now we know it ain't. And there's a billion of medications to take. Like it takes time to find out things about, about a whole virus.
Right.
So, people get so upset, like the CDC just said this and they said this. They're coming out like every single day with new things, because they're finding out something new every single time. So us as Americans, we're so selfish and we're just so into ourselves. And, if it doesn't serve us personally, then I don't want to, I don't want to do it.
Yeah. Yeah, absolutely. Absolutely. You said something, you just said a whole lot of stuff.
I know, I went off on a tangent. I'm sorry.
No, it wasn't no tangent. No. It was not a tangent. But you said something a few minutes before that I've always kind of thought about. You said we're in a second wave. Do you really think that this is a second wave, or you think this is still the first wave?
I think, well, if you look at statistically numbers, numbers were starting to go down. I don't think that coronavirus went away at all.
Right.
But I was talking to one of my friends last, a nurse practitioner as well too. She works in the hospital, and we were just like, because they said like kind of the incubation period is like 14 days. Mm-hmm. So we were kind of going back, and where we're seeing surges here in Atlanta, and I'm sure you guys are seeing them in Dallas as well too. We're going back. Mm-hmm. So it's like, this is kind of 4th of July people that were affected. You know what I'm saying? Yeah. And then so people who went out and kicked it 4th of July. I don't know if y'all saw the video from Compound here in Atlanta where they had a pool inside. And
yes, I did. Oh my gosh.
I wasn't there, people. Video. Okay. Cause I was sitting my butt inside, because we don't celebrate 4th of July. So then, and you remember 4th of July where like Miami was shutting down like their beaches and there really wasn't a whole bunch of stuff going on 4th of July. So if you go 14 days back, that's Father's Day weekend.
Oh, wow.
So, and this is when a lot of things were opening back up for some states and for some cities. So I'm not saying at all that coronavirus went away. I'm thinking that it's a surge from probably people getting out and doing more than they were prior to.
No, you're right. The other thing you said when you were saying like how, things are just constantly changing. We're getting new information out all the time. I think people forget. I went nowhere near a medical school, but there are things that I do remember from like biology class and things of that nature that like viruses, these type of things, they can mutate. They change constantly. So to expect it to behave one certain way, I think that's ignorance on our part. You know what I'm saying? So we should expect there to be constant, not necessarily changes, but just new information.
Kind of like ebbs and flows of it. Yeah.
Yeah. Absolutely. That's all I was going to say about that.
Do you see this being something similar like flu, like how there's different strains of flu that this could possibly progress into, like different strains of this virus? I mean, I know corona itself is this whole category, but
yeah, I mean, I'm sure. So I am not the best on reading articles. I mean, to be completely honest, because I just don't want to be inundated with all of this information. And there's just new stuff coming out every day. But I'm sure that there is some research going in on, whether this virus has mutated, whether it will mutate. And then, one of the biggest, I think the push is coming from is to try and get this under control before our known flu season.
Yeah.
To have, hopefully we don't have a combination of coronavirus and flu. And, there are people who think that they can't get co-infected because I think we actually did have a co-infection early on because this coronavirus started before the end of last flu season because flu season technically ends in April. So we did have a co-infected. And, it would be interesting to see because, we have flu A and we have flu B and we test for those. Be interesting to see if by the time that this comes around, if, hopefully we don't have a SARS-2 COVID-19 2.0. I know that wouldn't be the naming of it, but if we don't do the things on the outside prior to like proactive, then who knows what can happen, to be completely honest.
Yeah. It's just so many unknowns, and that's what makes it even more scary because we are just living recklessly. Did I see that? And we don't know yet. We don't have a good handle on this, which I want to go back to your point where you were saying that everything's around this seems to be politicized, which I agree. Because of that, do you feel like this pandemic and how it's been handled and how it's been made into a political kind of statement type thing, has this affected the way you view your career in healthcare, or has this, ongoing fighting behind the scenes solidified your reasoning for choosing this path?
I would think it solidified my reasoning for choosing this path, but also solidifying me moving past being reactive in medicine. So I really want to take a proactive approach. That's one of the reasons why I'm obtaining my doctorate, because this is all a reactive approach. And I think I got really frustrated last week with just this whole thing and, working and having to see these patients. But I think that Americans really enjoy a reactive approach because you're getting advice on how to be proactive every single day, wearing a mask, socially distancing, staying at home, going out when you need to. And then no one's saying that you have to stay at home. Like martial law has not been enacted, but if you do need to go out, just be smart about going out. And it seems like it's so easy that no, that can't be the thing. Like there has to be a medication or a drug, or it has to be a drug that would prevent me from getting it. So I'm that's all I gotta say on that.
Well, I think with anything, and especially where it's like a sudden drastic change, you're talking about death, and death is involved, people losing jobs. The norm is it's completely different. Everything is shifted for everyone in the world. We've got to talk about our mental state and how this is affecting our mental state. For you, how has this had an effect on your mental state as a Black woman and as a Black woman who works in healthcare and is fighting this thing firsthand? And then also, follow up to that, how are you caring for yourself in all of this?
Like I said earlier, it's definitely been ebbs and flows, range of emotion going all over the place, where I remember when everything was just starting to be besides about coronavirus. So I talk to my mom at least 2-3 times a day, before work, after work, sometimes in between, depending upon how my day is going. Yeah. And she watches the news. So she would always be talking to me about coronavirus. It got to the point where I was like, I am not entertaining a conversation about coronavirus right now. Like, I don't want to talk about this. I am being inundated with this information at work. I want to just have a regular conversation. And, she got offended at first, and then she came back and she apologized. She was like, I can't imagine, what you're seeing and what you're dealing with, and just having to talk about it all the time. So she was like, I apologize. I'm just talking about it just to try to gain more understanding, but I can see it from your standpoint. Because I remember for a long time, I was like, if you want to talk about coronavirus, if you want to talk about something that has to do with coronavirus, don't call my phone. I got off social media for a while because it was just, and I love how social media, everyone's an expert on everything. Especially Facebook. So people giving their expertise and, what you gotten tested, and what about this, and what about that, and what about that? Individuals who are far from the medical field, like artists, far from the medical field, talking to you, giving their perspective on coronavirus. So I think taking time away from social media has been helpful. Wine was my friend for a long time, but I had to give wine up because too many carbs. I think at this point in time, kind of gotten a handle on it, and I think if you ask any medical professional, like I made a joke one day with some ICU nurses and a cardiologist, where I was like, we have to be some sick individuals to get into this. Because, the things that you see, the things that you hear, you witness, the things that you end up doing, you're like, how can the human psyche take all of this at one time? So I think dark humor has definitely helped, but as a medical professional, you learn to cope, and you learn to compartmentalize most things. And, when you need to react, whether it be cry, yell, just be sad about things, you definitely do, but you just learn, you can't unpack your bags and stay there.
That's good.
Yeah.
That's the word in general. I love the fact that, you're just like, listen, I've got to remove myself from one space or the other. Like I do this this is my career. This is my job. I'm immersed in this. So I can't be having side conversations and logging into Facebook to be social and, just kind of keeping it up for a little bit. And this is all I'm seeing.
Right.
And not on top of that, it's just foolishness that you're
straight foolishness.
So I get that. Definitely. I don't even deal with this on a daily basis.
I'm glad that you recognize that about yourself, and you were self-aware to know like what you need and to walk away from something that is not serving you. So
yes.
Oh yeah, I was having a block party. I'm like, if you want to call this phone this morning, you can, but you will get blocked. Don't call me. You have, they hear that you're a nurse practitioner. They know you're like, so what's your take on it? I'm like,
yeah. I'm glad I didn't ask you. I just texted you a couple of times just to make sure you was alive.
No, you definitely did not. No, I greatly appreciate it. For some people, like, I remember, my close friends, I definitely didn't mind, answering questions, but it was individuals who I ain't talked to in a minute. Like, what's your take on it? What about this? What about this? I would straight copy and paste CDC. Like, I would give them the CDC website and they were like, really? Yeah. I'm not, just because I see this every day, I'm not an expert on this. I can give you the human perspective and seeing things and giving you more of a knowledgeable perspective, but I'm not Anthony Fauci, so I can't tell you the ins and outs of it. And I know that he can't tell you, he can give you a way better explanation of everything, but he won't be like probably things that he says now, 6-7 months from now, might not necessarily hold as much weight as it did today.
Right.
But the reoccurring theme is, and I'm just, going to drop this every now and then, is to wear a mask, socially distance, wash your hands, stay at home if you can.
Mm-hmm. That's that on that.
On that.
No, you just drop that in there like I'm just plugging my new album. Wear a mask, stay at home, wash your hands, social distance.
And arrest the cops that kill Breonna Taylor.
And arrest the cops that killed Breonna Taylor and Elijah McClain.
And Elijah McClain.
Anybody playing with y'all?
Stop playing with us.
Quick note on social media, because I did see your recent post. I think you posted, was it last week? And you posted a picture of you holding a vial of, was it Remdesivir?
Remdesivir. Uh-huh.
Yes. Can you share us a little bit about that moment and what, I remember you mentioning that you had a conversation with your MD about what patients should or couldn't, like you had to make a decision about how to administer possibly, I don't know, could be a life-saving drug, but if you can share a little bit about that.
Yeah, so the picture they're talking about is I was holding up a bottle of Remdesivir, which is the new antiviral that was formulated to potentially treat the coronavirus. New, meaning it's not much of it. So we are literally, hospitals are rationing out Remdesivir, not because we don't want to treat patients, but because we only have so much of the medication. So I have the vials because that, like I've said, we've been fighting coronavirus, I guess you can say, since the very beginning of it. So one of the pharmacists have kept a lot of the vials as just kind of, souvenirs to say that we hopefully survived coronavirus pandemic. But we just recently got a shipment in of the medication, and we don't get much of the medication in. So I'm not going to, go into specifics because keep my job for at least another year. So we were getting consulted from the hospitalist to help to basically see if patients qualified to have the medication that could potentially help treat the coronavirus, in addition to antibiotics and, other modalities as well too. So 2 patients that I saw, a elderly white man who was immunocompromised, was on taking a chemo pill, and then I guess by lay standards, she's an elderly Black woman. So I saw the elderly Black woman first because she was my first consult. She was sitting up in the bed, answering all questions, really didn't appear short of breath at all. She was on a whole bunch of oxygen. She was on 10 liters, which is a lot. But she was statting 100%, which is A+. You can't get any higher than that. Looked comfortable, asked her about all of her symptoms. Apparently she had gotten it from her her sister, who possibly got it from the brother-in-law. She was doing okay. So we just decided to keep antibiotics going on her. And then the next person that I saw, just reading his chart, he was much sicker than she was. So I went to see him. He was on what we call a high flow nasal cannula, which is basically the step right before intubation, or a tube down your throat on a ventilator. And then he had something called a non-rebreather, no, not a non-rebreather, a venti mask on that gave him additional oxygen because he was unable to hold his sats. Basically, he was having issues. He was breathing on his own, but he wasn't, what's the easiest way to say it? His blood wasn't carrying enough oxygen. Like, he didn't have enough oxygenation to maintain what we like to see, 95% or above. So out of those two, and I mean, literally, when you're making this decision, you are going off of the acuity of the patient, like how critically ill they are. This man was about to get intubated compared to this woman who was maintaining her sat. She was looking fine, wasn't complaining of much at all. Just, really some nausea, wasn't having much of an appetite, and a dry cough. So this man got the remdesivir. But then we're going to go back and, we have further conversations. Because I am a human, I'm like, this woman, and this is the thing we do know about the coronavirus. You could be fine one day and the next day, you could have a tube down your throat. And Black individuals right now are not doing the best compared to white individuals. And if you think of quality of life, and not quantity, but quality of life, he doesn't have as much quality as she does.
Right.
So when you're sitting there weighing those decisions, and then if I wasn't a Black woman, if I was maybe a white man, if I was a Trump supporter, what I'm saying? Like a lot of those things go into your mind. Like, would this person automatically have picked the white man just because he's a white man and he deserves to be treated better than this Black woman over here? It's one of those things that, was just weighing, and, we ended up deciding to give the remdesivir to both of them.
Yeah.
But the thing is, you don't know. That takes away two. It's not just one vial of remdesivir. It's like, I think maybe 6. It's a 5-day course, but the first day you get 2 vials. So it's what's the math on that? So six vials. So, you think about what, you're treating these 2 patients. You don't know how well they would do, but you think about other individuals who could come in the door, tomorrow or the next day, who could be much sicker, who could be much younger, who have, a greater quality of life than these individuals. So, my reason for posting that was to stress, you all talk about freedom and, don't want anyone telling you not to wear a mask. But when you walk into the door of a hospital, your freedoms are gone, especially when you can't speak for yourself. You can't breathe on your own. Like, you are literally, medical professionals are making decisions for you. And, especially if you have coronavirus and, right now we're not allowing visitors. Families, yes, are able to make decisions, but they're having to make medical decisions without a lot of families who have had to say goodbye to family members, via FaceTime or through a window or, over a phone because you can't come into the hospital.
Right.
So that was it was a tough decision, enlightening decision, and just things that you didn't think that you would actually have to do because, we're in 2020, we're in modern day times. Why don't we have enough medication to give to everybody? Yeah. But because of this pandemic, because of the sheer volume of patients that we're having that, are getting critically ill and being hospitalized, we have to ration these things out for the sickest individuals and what we deem as the sickest individuals. You know what I'm saying? And, have no way of knowing this patient could be sicker than these other patients tomorrow. But because we had to make this decision today, you didn't get this medication. That could have potentially been more helpful than our other medications.
Yeah. I have so much respect for you. I mean, I've had so much respect for medical professionals in general, just because of the work that you have to do. But man, I commend you. And I don't really know what to say. That's heavy. That's heavy.
Yeah. I mean, it was one of, like I said, you do this for so long, because I've been in nursing for a decade now. So you do it so long that you learn to compartmentalize, you learn to leave things at work, because if you didn't, I'd be crazier than Kanye West right now. But I'm not. There's some days where you can't help but leave work, and you can't help but have things weighing on you. You can't help but, crying in the car, crying sitting at your desk because this patient just died, or it's just, where you feel like it's just so much out of control and you don't know what to do. And I mean, even physicians have said, like, all my years of training, I don't know what to do. I'm doing the things that I was taught to do, but no one was prepared for a pandemic of this magnitude. And I remember having one of these conversations with another colleague at the very beginning of all this. And we kind of equated it to the military. Because, when you go in the military, there's potential for war. There's potential, you're potential to be on the front lines and you're giving your life. That's when you sign that paper, you already know that's what you're signing up for. When we signed to be a physician, a nurse practitioner, a PA, we don't sign up to give our lives specifically. We sign up to give our all in everything that we are doing, to make ethical and moral decisions, and to not let, racial biases, religious biases, any other biases getting in the way of taking care of patients and families. But going to work literally not knowing if I'm going to catch something that could potentially kill me every single day. Yes.
Yeah.
I mean, it's heavy if you think about it, but
put some respect on y'all name, because what you're doing is not just, like you said, this is not just mechanical type of stuff, every day in and out, that doing the same thing over and over again. You have to consider all the other things that come along with this, and especially the emotional wear and tear. Y'all are human beings at the end of the day. And you're concerned about your patients and your patient's family, but you're also concerned about yourself, your coworkers, the people back at home. Like, there's so many other things that you have to take into consideration as a medical professional that a lot of times people on the outside don't think about, don't consider how this is affecting y'all. So this is very, very serious. I know that we talked about it. You said it multiple times within this conversation, but we're going to talk about it. What is the importance of wearing a mask?
It's the easiest thing that you can do to prevent the spread. So coronavirus is transmitted via respiratory droplets, coughing, sneezing, talking, singing. So, just doing what we're doing right now. So if you wear a mask, you basically cut down the transmission of any of those droplets. I think it's like by 75. I think the numbers are much greater than that. Y'all could probably edit that out because I don't know the numbers. But it's severely cut down by just wearing a mask. So the picture is if you were to wear a mask and I didn't wear a mask, you cut down the transmission by 75%. But if both individuals wear a mask, I think it's like cut down by 99%. And, additionally, like socially distancing. So it's like the simplest thing that you can do. And if you think about wearing a mask, like you're like, oh, well, I don't understand the importance of wearing a mask. When you go to war, you put a helmet on that soldier before you go to war. And I'm talking about sex. You don't want to get pregnant. You don't want an STD. And going to the grocery store, going to Target is not as pleasurable as sex. So I don't understand why you can't wear a mask.
Right. Well, and I think for whatever reason, people also are kind of buying into, or not, I'm going to say not buying into the lie, but people don't seem to understand that a lot of the wearing the mask is not per se always for you, but it's for the other person.
Absolutely. And now we also are aware that, asymptomatic carriers, individuals like who don't have symptoms at that point in time when we're talking still have the ability to shed the virus and to give it to you. And shedding the virus, meaning that droplets from orifices. So the orifices that we are speaking of specifically are the mouth and the nose. That's why they do why they do the coronavirus and the coronavirus swab in the nose, is that you shed the virus and you shed it that way, and you could potentially give it to somebody else.
Right. So we basically should all be walking around almost with the assumption that we could be asymptomatic.
Right.
Bless it. And not because of that, but just bless it because people just refuse. Absolutely refuse.
Yeah. And I guess like the whole, and we were taught in nursing school that, when you're drawing blood, you assume that everybody has AIDS, Hep C, Hep B, whatever. And we now know that HIV AIDS has no face. So you don't know who has what, right? But you assume, it's not that you assume the worst, it's just that you're protecting yourself, right? So if you don't care about anybody else, at least protect yourself. So you assume that this person right over here has coronavirus. So I'm going to protect myself and I'm going to wear a mask. This person might not necessarily wear a mask, but I'm going to wear a mask and I'm going to socially distant from that person because I don't want it.
Right.
And then we've had a couple individuals that, and of course, these are younger kids, and I don't know the demographics in terms of age-wise that listen to the show, but I'm hoping that parents, aunties, godmoms, whatever, that listen will tell their younger friends, whoever this as well, to these coronavirus parties, where, you go to a party, you see if you become positive, where younger people, we don't, that seem to be faring well, that don't have like any asthma, that don't have any like type 1 diabetes, type 2 diabetes, that don't have any other comorbids. Typically, yes, what we've seen, they're not as sick as older individuals. But what happens is that you end up, because you don't feel sick or you don't look sick, you end up transmitting it to your parents, your grandparents. And now your mom and your daddy sitting in the ICU, intubated, fighting for their life. Yeah. And I mean, we've had situations in the hospital where they've gotten it from their son because their son was out partying. And I think Keisha Lance Bottoms, the mayor of Atlanta, I think her son, who was like 18 or something like that, he was the one that gave it to her. Yeah, because he was out and about. Like I said, if you don't care about yourself, at least care for others. Or if you don't care about others, care for yourself. Just care for something.
At least
care for something.
Or if you don't care about nobody, stay your ass at the house.
Stay your tail in the house.
Just stay home.
Which brings me to my next question. Based on the things that you've seen and what you know, do you feel it's safe for students to return to the traditional schooling format?
No. If we can't, so Terry, I think I told you this. My best friend, she is an assistant principal in Houston. And she brought up,
Tell me this.
Oh, okay. Well, she's been a teacher for a while, but now she's been assistant principal for 2 years, something like that. Okay. But she brought up a great point, and I was like, "Bro, you smart." She was like, "If we can't get adults to get on one page, what makes you think that we're going to get students to be on one page?" And she's in the high school sector, so school students. So good and doggone well, if you can't get high school students who, you can basically tell them to do something and they take that in, they have that concrete thinking, they know what they need to do. How can you get 5, 6 up and above year olds to know what six feet apart looks like, okay? And to stay 6 feet at all times, to not be touching stuff and, digging in their nose, whatever, because we know what kids like to do. And then to wear a mask, to keep a mask on. We don't even like to keep a mask on, for 10 minutes. And then you're also expecting, and this is, I think, and maybe these are female predominated fields, and maybe I'm about to go down a rabbit hole, but we see how much respect we have on certain fields. Education, we have such a lack of respect, and maybe is it because it's a female product, we just don't care. Like nursing, the majority of individuals who are on the healthcare line, females predominate that field. Right. I mean, individuals who we want to give the most at this point in time to teach the nation's children, to take care of the nation, we as a country just don't care. So I don't understand. No, I don't think it's safe. Because there's not a plan. There's not a safe plan that's in place. And I know that, you guys are states away, but I don't have any kids, but just hearing things that go on, I live in County. So I think Cobb County was giving parents options. I think Fulton County was maybe starting the beginning of the school year, maybe virtual, possibly. I know Fayette County was given options. Gwinnett County is all virtual. So Gwinnett County has the highest proportion or the highest number of cases here in Georgia. But Fulton is next, but Fulton has most deaths in Georgia. And the other thing too, which is sad, and I'm thinking about Fulton County, especially Atlanta public schools that have the highest proportion of Black and brown students, or Black students specifically. So now we have this whole racial divide of what are kids going to do for school? Because you say, oh, we can start virtual. Mm-hmm. Okay, yeah, maybe y'all gave laptops to kids. That's great. Do these kids have Wi-Fi? Are you making sure that every student has Wi-Fi so they're able to be successful? So instead of their president stating that their president and Betsy DeVos stating that they are going to cut funding to education, which I don't understand how you would accomplish that. But like, let's come up with options that actually work.
Yeah.
But no, I don't think it's safe.
Yeah.
For the third time. No, I don't think it's safe.
No, we are right there with you. I was in the classroom for a few years, and I could tell you, and I was in the special sector, but at the same time,
and kids, and you bring up a good point. Kids with special needs, like
special needs,
who can't unfortunately follow instructions because of developmental reasons. You can't keep them with masks on. You think about kids with Down syndrome. I'm sorry, go ahead.
Yeah, no. I mean, you're right. And I was going to say, not only that, a lot of those students have not only developmental delays and issues, then they have medical issues on top of that. A lot of them are, because developmentally they're 3-4 years old. What do 2-3-4-year-olds do? They drool, they put their hands in their mouths, you have to change diapers. Like, there's so many other things that come along with that. So then you've got to think about them. You've got to think about the teachers who are having to be severely hands-on with these students. And not only just them, but I also, I think I told Yana this a few days ago. I was like, you think about just like teachers are, yes, they are teachers, but teachers have lives outside of the outside of education, outside of the school. Some teachers are married. They have kids and other family members, and we don't know what's happening within the walls of their home.
Right. It's also like what Jasmine mentioned earlier about, teachers didn't sign their lives away to.
No. But I'm gonna tell you this. And I might get, I ain't getting in trouble for this because I don't work for the school no more. But like, I remember when I was working special ed, and we were dealing with a lot of really kids who were violent, who would hit and throw things and bite, and we'd have to use CPI restraints. And it would get to the point where it was just so out of control. And we're reaching out to admin and other people in education and other agencies, and what people in admin sent back basically an email was like, y'all signed up to get, and we got to blur this out, but I'm gonna say it, y'all signed up to get shit hit and bit. This is your job. This is what you signed up for.
They don't care because they don't get it, and they don't have to get it. Yeah, because they're like, I've surpassed all this. I don't have to care about it. Y'all just need to get it done and make sure we make our money.
Exactly. That is it. And that's the bottom line right there.
It's all about the dollar. Like, just within this, I'm sure you guys have seen this in the news of how healthcare organizations, systems been cut. Now, you never heard about doctors and nurses and medical assistants not having jobs. But because through the first surge, weren't making money with elective surgeries, folks had to go. So making money. So you realize that when you cut individuals like that, that leaves you short-staffed to take care of critically ill patients that, should be 1-to-1 or, one nurse to one patient, because of whatever they have going on, or critically ill patients that you're having to stay in the patient's room for forever in full PPE, full attire. But they don't care because it's about making money, and it's about, making a profit at the end of the day.
It's sad. It's really sad.
That's how I'm gonna work for myself one day, like y'all. Mm-hmm.
Come on, girl. Let's go. Do you know, has anyone that, girl, I can't get the question out. Do you know anyone that's been affected by this virus personally? Colleagues, family,
I do.
anything like that?
Mm-hmm.
What were the, I guess, what were the effects? What were some things that you saw from that that you can at least share, I guess?
Hospitalization, longer recovery time, time off from work.
Mm-hmm.
What's the word I'm looking for? Realization that you aren't as important as you thought you were, because these organizations will continue on without you.
Yeah.
I guess.
Yeah.
Being ostracized, because this is kind of, and it still kind of is, I'll be completely honest, like how AIDS patients used to be on the wards by themselves and nobody would come see them for hours at a time because you didn't know how it was transmitted and you didn't want to get it.
Right.
People are afraid of this, don't want to go place. And I'm sure you all know at least one person who was like, I'm not going nowhere because I don't want to get coronavirus. Or people who are who've turned into monk and are just wiping down any and everything and be looking at you like, don't hug me, like don't get close to me, type of thing. So yeah, those are the things that I've seen with individuals who have been personally affected.
So again, how can we help you help us? What are some parting words of advice that you can leave our listeners?
Wear a mask, socially distance, hands, sit down, don't take unnecessary trips, don't go to Florida, and just know that it's real. And if you don't think that it is, it will show you how quickly how real it is and that it doesn't discriminate. Like in terms of death, in terms of how, how bad you'll feel, like it, like it really, it's real.
Yeah, and just the whole, what you just said, especially the whole it's real thing. And once again, we have our Facebook graduates who have their Facebook medical degrees
with honors,
who, post the articles with honors, that post these articles and these links and these clips and all this other stuff about it's fake, it's this, or it came from this place
this lab.
or this place. Here's my thing. Yeah, here's my thing. At this point, I don't care where it came from, who brought it here, who created it in a lab or whatever. The issue is that it's here and people are being affected by it. I hate when people are like, well, it came from, who cares at this point?
I don't care if it came out of a lab. I don't care. I don't care.
It doesn't matter. And no. It does not matter. People are dying, and people will try to use that as an excuse as to
we don't have to take it seriously.
We don't have to take it serious. It's foolishness. Once again, it is foolishness. That's all I want to say about that. Last question for you, which I feel like we could definitely go down tons of rabbit holes in general about all the things that we've talked about today. But do you feel hopeful that we will find a resolve with this issue?
I was hoping y'all wouldn't ask me that question. Because, I want to be as hopeful as possible. I just don't know if everybody will get on board to do the things that need to be done. Because now the estimates are, if majority of Americans wore a mask, we could get this under control in like 4 to 8 weeks. And that was the thing back in March of like, we were expecting high numbers, when New York was greatly affected, that, things would look great. Like we would get like to a plateau in like 4 to 8 weeks. And it's like, we got there, but are we going to continue doing this up and down thing? Because as soon as, folks get a little freedom, they act stupid. So I don't know. It's, I would like to see things with rose-colored glasses, and I would like to see that there would be an end to it. I would really like to feel hopeful, but I think, and it's not being pessimistic, but I think it's more just being realistic and probably because I see, I see things, and I know my hospital yesterday was on full diversion meaning ain't no room in the inn. Like, if you are critically ill, no, we're not going to send you away, but we advise you to go to another hospital. But of course, like ambulances or whatever accepted in, you're just going to probably sit in the ER for 24 or 48 hours, however long it takes to get a bed. And, people are not moving out as quickly as they used to because people are sick, So I really do want to remain hopeful. It's just that I have 20/20 vision on what coronavirus looks like. So it's hard not to be realistic about it.
For sure. No, we when we ask the question, it's not for you to give us a PC answer. It's a real question.
But you know how like you want, if I was listening to a medical professional, or I was listening to, a expert on something, you know how you want to hear that, yes, something is possible if you do X, Y, and Z, we will get out of this and blah, 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 blah.
But you're a human first, Jasmine.
Right.
And in real life, like, we see how and I'm saying I'm talking about the foolishness that's, that's going on, that we're just not doing we're not listening to the advice of the professionals, the people, and what the science is telling us behind this. And just, and I've always feel too, like, as Americans, we still operate from this place of privilege, some more than others. And we feel like because we're the U.S., that we're Americans, that this doesn't affect us. But when you see the actual numbers and you see other countries and going down or don't have, as many new cases, or they're trending downward, but we are like astronomically.
I mean,
still going up. It's just like, what does it take? Like, even then, I don't. It just it frustrates me as somebody who typically is, and I understand where you're coming from, who's someone who's just, that wants to be optimistic, always wants to be positive. And you can't get nothing positive out of this when people doing
just reckless stuff. And I mean, you see reckless stuff every single day. And it's like, well, and I wonder if it wasn't such a political issue, would people believe it? And I think that's, the media does what it's supposed to. So I question that. If it wasn't such a political thing, would people put more respect on it? And, I think 2020 this year showed us all about, I've definitely been humbled in 2020. I definitely have a lot of perspective and a lot of patience. We all have. I don't know if some people have, though.
Well, you're right about that. You're right about that.
It just shows us how quickly life can be taken away from us and how things are totally out of our control. And I think that God has been talking to a lot of us, or has tried to talk to a lot of us, but a lot of us still aren't listening. And I think that if this is the overall theme of God speaking to us and we are not listening, and it's like, hey, this ain't gonna go away until y'all really and truly listen. Or
you sit down.
No, I set fire to this place. Y'all remember that fire in Australia at the beginning of the year?
That part.
So not to get all super religious, but it's something has to give, and it's I don't know.
You're absolutely right. Everything you said, and Yana and I have had these conversations too. And like you said, not to, get super whatever, but we keeping it real. This is part of who we are. Like, it's crazy. It's the irony in that, everyone went into 2020. I think with this notion of this is going to be that year, we take it on.
Yeah, it was a new decade. Yes. Like this is gonna be it for us.
And like you said, I think God, this has been a year. We're still in it, but it has been a year where God has been revealing a lot of stuff. And like you said, and they're not listening. We're not listening. And I would hate to see what happens. Because a lot of this, sometimes I think of it as like, man, this has been a moment, like Yana said, it was like, guys, like, I'm telling you, like, sit down. Because I got a lot of stuff we need to address. I got some stuff that I'm trying to say. So
sit down, listen.
It's been a way to slow us down, sit down and listen. But even in this, he has sat us down and we are still refusing to listen to him. We're refusing to listen to him. And at some point, he's going to be like, okay, since y'all just absolutely refuse to listen, then there will be consequences of even greater magnitude than what we are dealing with right now. The other thing is that, the current occupant of the White House has, I also find this ironic, at one point, made a statement about other countries in the world and he called them S-hole countries. And I feel like right now, America is the S-hole country.
Bahamas ain't letting us in.
Listen.
About Bahamas, they go off of tourism. You think about a lot of those Caribbean countries, the majority of their economic growth or, their money comes from tourism. They cut off America.
Yeah. They said,
if that don't tell y'all nothing, and you think about Italy, before this really hit hard here, it was just beginning here, how hard Italy was hit. Italy is recovering. Italy is doing well. Yes. Italy does not have cases like they used to.
Yeah.
What? And we have such great things over here. What are we doing?
What are we doing?
We have states looking like Italy.
Right.
Like that.
And then if you look at New York, who completely ignored orange, which is the smartest thing to do. This is why I know I need to move to a blue state within the next couple of years because I can't continue this red stuff. I love the color red. Shout out to my sorority, but I can't no more. But if you see how New York actually did things and actually stuck to the phases and actually kept things shut down, New York is thriving. Mm-hmm. And I think Cuomo was coming to Savannah today. He sent materials down to Atlanta last week. Cuomo's on a national tour. I wish he could take over for Biden, but that's neither here nor there.
I know we feel you on that.
But I mean, it's crazy. People are like, oh, that happened in Italy. That happened in. No, it actually can happen in the United States as well too. If states would actually pay attention and care about their citizens and have people sit down, shelter in place, wear a mask. Yeah. If you need to be out, you need to be out. And even Cuomo was like, we're not making kids are not going to be guinea pigs for us.
No, it makes absolutely no sense. The TEA here.
Oh, I was like, what's it?
Sorry, the Texas Education Agency. So they're basically over all the districts here, and they are like the head honchos. Mm-hmm. They will not be returning to their offices until January 2021. But we want our children to go back into these buildings.
And that's the thing that kills me. I'm like, so because y'all, they said that kids seem to do well from the coronavirus, we're still going to take that risk,
right?
There's something I want to say there, but I'm gonna just stop. Yeah, it's just something you just want to shake some people. I just want to go and shake them, Lord,
shake the table, shake the table, because it just, when you, and then the things too, like I said, I don't have kids. So, I'm thankful that these are not things that I have to worry about, but just as a human who cares, you're like, did you say that out loud? Like, did you how you write stuff down and then when you read it out loud, you're like, that don't make no sense. Hold on. Let me go back and let me go back and fix that. Like, did you really say that? Oh yeah, we're going to make kids go to school and we'll just see how things go because kids need to be in school.
And then you say in that same breath, we're going to leave it up to the parents to monitor their children and send them to school. When we know even before
listen, the lies. Yeah. I'm sorry.
Yeah. This coronavirus is all about an honesty policy as well too. Folks still be lying. Be like, no, I ain't had no fevers. Get up in the room. Bro, you got 103. What you doing up here?
Parents be doping their kids up on some Tylenol and ibuprofen and sending them to school.
Don't go to school. You're fine. Drink a little water. Yeah. Like, I saw on the news this morning, I happened to turn it on. They were showing this couple, I think in Kentucky, that they actually had to, put them on house arrest. They had ankle braces on because they have COVID, and they were like, they're not staying home. They were refusing to stay home. They had to put them on actual house arrest. So these are the type of people that we.
Oh my gosh. Oh my goodness.
Yeah.
Wow.
So, we could, continue ranting on, but, if y'all listen to this far, first of all, appreciate it.
Thank you.
We appreciate even more if we could just be responsible and really this is just not for your safety or just the safety of others. It's if y'all are talking about you want to get back and do your normal life,
Normal stuff. Yeah.
we're pushing that timetable back further and further along by going against the guidance of what we've seen has worked for us or is working in other places.
Do people not get that college football is done data for the year?
They still trying to make it
people
work.
Not get that Black Friday. Y'all Black Friday ain't finna happen. Christmas ain't finna happen. Y'all keep playing. Like y'all finna have a Zoom Christmas.
Absolutely. I think.
And y'all think about this. Zoom done made so much money off of Americans. Ooh,
What did the Pac-10 pull out? The Ivies pulled out. If the SEC pull out, which I pray to God they don't, but SEC pull out, it's over.
Well, I know Alabama canceled his first game.
Oh, I didn't know that.
Yeah. We played USC this first game. Yeah, they are. I'm like, I guess the Lord knew that this was going to happen. I'm like, the Lord knew this was my year because I got school to worry about, so I don't need to be.
He said, I need you to focus.
Yeah, I was like, okay, well, okay. I guess I'll go ahead and cut the cable off because clearly ain't nothing to watch. Y'all, we were supposed to have Olympics. Like, we were supposed to be watching the Olympics right now.
I forgot about that.
Yeah, like, track and field was finna be on. Like, we was finna see Simone Biles. Like, no, y'all playing. Nope, y'all playing. Y'all don't want to wear masks.
And we gonna be sitting in 2021 looking foolish, looking back like, man.
I refuse. Somebody gonna have to open their border or something because this ain't gonna work.
Not for you, United States citizen.
All the U.S. is gonna be.
They were like, no, baby, you ain't coming up here with your coronavirus self.
I know, right?
We're gonna be over here trying to get some fake European passports.
They finna call y'all Corona Americans.
Right. Somebody let us in, please. I need a dual citizenship or something.
What I tell you, Terry, your other countries' mamas. No, tell your little friends you can't have company.
Yeah. U.S., can we come to play?
No, nah, baby.
Y'all tell them they can't come over here today.
Oh, wow. Well, Jasmine, thank you so much for lending your expertise, your advice,
of course.
Just, and everything that you give every day to fighting this. We do appreciate you. I know you don't hear it enough, and we'll definitely continue to do our part on our side. As for me and my home, we're gonna stay at home.
We're gonna stay masked up.
Same here.
As for me and my house, well, that needs to be a Bible verse for real. As for me and my house, we're gonna stay masked up and inside.
Hey, facts. Leviticus, I think like 13, chapter 13 or something. It talks about leprosy, people with leprosy, and I know it's a Levitical law, but it says, hey, if you got that stuff, hey, mask up, basically. It's literally said, cover your mouth and your nose and keep your distance so people know.
Lord, I don't know if you taking new submissions for the Bible, but I can help write the Chronicles if you need.
I hate you.
Everybody turn to Chronicles 19:1.
Genesis 3:16. Heck yeah. But no, Jasmine, thank you so much for coming on today and having this conversation with us and, being super honest and open and candid, giving us the real like you always do, because that is just who you are.
Yes.
We appreciate it and we love that about you. And as I think last week, Yana was like, see if we can get Jasmine on. I was like, I'm on it. And she was like, we were having a meeting and she was like, what you doing? I was like, no, I'm texting her like right now. Like,
well, y'all know I'm always available for y'all. No, I appreciate this platform, and I think highly of myself, but I don't think highly of like the things that I do, because I think that's just God's calling on me, what I was supposed to do. So I'm like, this is just my everyday thing. So I appreciate y'all thinking about me and actually wanting, the perspective of a healthcare provider on here. So no, I thank y'all so much for allowing me here.
Well, we think highly of you and we think highly of what you do.
So thank you.
Yeah, definitely. We thank you so much.
Yeah, no, I was at Chick-fil-A one day. I was in the line. She was like, oh, thank you for your service. And I'm looking at her, I'm like, I'm not in the military. And I had my badge and I was like, oh, girl, you welcome. Get my chicken sandwich. You welcome. I was like, what are you talking about? Yeah.
Did she give you a peach milkshake? Because I ain't going.
No, they didn't give me nothing for free. I was like, y'all want to get on this and give people stuff for free, but they support Trump, so I couldn't expect much. Shrugs.
Thanks.
Yeah. It's a lot of that coming out later.
Yeah.
You don't know what to eat or support.
No.
Drink shot. No more.
This was pre like Black Lives. This was pre Floyd, Black Lives Matter. We see in people's real true colors.
Yeah.
So
Yep.
Yeah. So that's another conversation. But
we're going to bring you back.
Hey, let me tell you something. I got time for that one. I mean, I got time for this one too, but I got a lot of time for that one.
For sure.
But hey, if you're listening, go support a Black business today and wear your mask while you're on your way.
Just, you know what? Wear a mask first and we can talk about everything else second. Just because.
That's real. We got to be here to have the conversation.
Right. Because I really want to get back to the fun infectious disease stuff. I'm sick and tired of y'all COVID folks. That's all I'm saying.
I love it. Well, until then, no, I'm just playing. Y'all, you want to close us out?
Oh, sure.
You close us out so well, so that's why I always let you do it.
Benediction.
Yeah, give us a benediction.
Well, at this moment, we're going to close and come to an end.
Well.
No, let me stop. No, I just want to say again, just thank Jasmine for joining us. And like Terry mentioned, always being so real and transparent. We know that we joked a little bit throughout this conversation, trying to keep some things light, but really, y'all, this is a serious time that we're in, and it requires us to be serious about it and do the right things. Again, please wear your mask. Please wear your mask.
Please
practice social distancing. Wash your hands. Mm-hmm. Wash your body in general.
Yeah, wash your legs. Wash your legs and your feet.
And your hair. But
I've still never understood that. You don't wash legs, but
but yes, please do your part so that we can return to some normalcy in our lives. But again, just thank you all for listening. We will continue to have more of these conversations throughout the season. And we hope that you will join us. But until next time,
melanate on that.
Thank you for tuning in. Hope you enjoyed our chat today. Keep the conversation going by heading to iTunes to subscribe, rate, and leaving us a review.
Have a story of your own to share? Email us at info@melanatedconversations.com or connect with us on social media at Melanated Conversations. Till next time, keep raising your voice. Are you someone who's ready to get your voice out into the world? Have you been considering starting your own podcast and not sure of all the things it takes to launch your show? Well, at Levels to Lunch, they've done all the groundwork to help you turn your dreams into streams. With professional knowledge and experience in strategy, recording, editing, and presenting, they have all the resources to help you in your journey in launching your show. From the do-it-yourselfer to that time-strapped podcaster that just needs to get it done, they walk you through every step to get your show launched and ready for the world. So go ahead and take that next step and make your podcasting dreams a reality by visiting levels2lunch.com. Again, that's www.levels2lunch.com.